Facebook is now the most visited internet site in North America. If you score friend status, you can see your pals' latest updates, view photos, share links, and even send virtual gifts. Med students tell me the vast majority of their classmates have Facebook accounts and share photos and other personal stuff with friends and family, but not patients. In an editorial published in USA Today, one internist wrote, "Please, don't ask me to be your Facebook friend." Don't tell that to Jennifer Dyer, a doctor in Columbus, Ohio, who treats adolescents with diabetes. Recently, she friended 4 of her hard-to-treat teens, not to pass the time, but because it's the most effective way to keep an eye on them.
Well, first of all, my teen patients do not really like to communicate by email. In fact, they mostly state to me that I'm the only one that they talk to with email because they don't really ever talk with their friends by email. It's only us old adults, you might say, that use email.
Present company included.
And so I find that they really will be more active about asking me questions outside of email on the Facebook feature, which is the protected kind of direct mail. They treat that like email, I would say. Ask me personal questions, ask me about birth control.
So you are actually functioning as their physician on Facebook?
Yeah, well, because they're my patients.
And it's the context, but it's the context of a doctor-patient relationship. It's not just me just giving general information on asthma and saying, consult with your doctor. You are their doctor.
Right. And under the laws, I mean, I am their doctor. I know them. I see them every 3 months at least. I'm able to practice medicine in that sense. But I'm not able to practice medicine on you or any other person that isn't my patient.
Do you think that their health is better because of that contact that you have on Facebook with them?
I do feel that their health is better because I get to be able to answer their questions very easily, and I think that it makes them more engaged.
Do you have evidence that their diabetes is better as a result?
Not direct evidence about Facebook, but I do have a pilot study that I've completed about involvement with texting on a weekly basis, and their hemoglobin A1C or diabetes report card is remarkably improved.
How does it work in practice? You texting your patients and they texting you back, or vice versa, I guess?
Well, I've read several studies in the past about using texting with teens and how that it improves medication adherence, and specifically in teens, because when you look at Pew Internet data, 95% of all teens have internet access. So teens are on the internet, but they're also on the internet because they use mobile phones. And mobile phones, if you notice any teen's behavior, they are sleeping with their phones. They have their phone at the dinner table, of course in the office visit with me. And it was fresh on my mind. These teens were all really good kids. They just didn't feel like having diabetes, and they were forgetting their medication with meals. They were, however, taking their medication late at night, so they weren't in the hospital. But they were still not in what I would classify as good health. And they just didn't really know what to do, and they're looking to me. And what I would do is on Thursdays at 5 o'clock, these teens, I would text them an introductory message and say, "This is Dr. Dyer, how are you?" The teens all agreed that they would be available at Thursday at 5 o'clock. The second thing that I would reference would be something that I know about our doctor-patient relationship, like how is band going, how's lacrosse, and we would have a discussion based on that. And
so
then,
the social chatting was important.
I believe so, because with a chronic disease like diabetes, it's more complicated than just whether you remembered your medicine. You need support.
Go on, I'm fascinated.
So the next 4 protocol questions are related to medical care. So I would ask them how are they doing with their insulin meal boluses, which is specifically what they were forgetting prior. Then I would ask them how they're doing with checking their blood sugars, because they weren't doing very good with that either. And then the last 2 questions I would ask were in reference to the fact that I thought that they would be improving their medication and their blood sugars would change. So I asked them, are you having high blood sugars? Are you having low blood sugars? And then I would conclude by saying, keep up the good work. I know this is hard. So I did that every Thursday for 3 patients over a period of 3 months. Their diabetes report cards improved from basically about 10 to 11% to 8 to 9%. And they were ecstatic. They were proud of themselves. They're engaged in their health. They felt better. They had less headaches because their blood sugars were in better control.
And these were patients you weren't able to get to in any other way.
Exactly. They like the availability, and they absolutely do not abuse that increased connectivity.
Now, most doctors are trained to be careful to keep clear boundaries between their personal identity and their professional identity when it comes to patients. Mm-hmm. How much harder is that when you and patients are connected through social media?
You know, I don't really find it hard. I think it's really similar to being a small town doctor. You know, you're there having your personal time, but people see you and people know that you're a leader in the community. And whether you want to be a private person or not, you're a public figure to some extent just because you're a doctor. And actually, one of the medical students on my clinical team, I'm the inpatient doctor this week, she was saying that at their white coat ceremony here at Ohio State, that when they put the white coats on, the dean said, you know, now you are being watched. You are a leader of the community. And I think it's important that professionalism is always thought of in that sense.
You are into social media in a big way as a physician, texting, Facebook, Twitter. How have these three and others changed the way you practice medicine?
I would say that this has made me happier with medicine.
Happier?
Yes. Every July, I read my essay that I wrote to get into medical school. And I try to ask myself, am I doing what I thought I was going to do? Am I fulfilling the dream that I had of trying to help people? And I think that social media has brought me closer to my patients because whenever you have a chronic disease, I've just learned that medical treatment isn't the only way to help people. That really to be a successful clinician, I need to support the person, the family, because when they're facing uncertainty, anxiety, and fear about chronic disease like diabetes, they need more than just take your medicine. And I feel that social media allows me that outlet because I know my patients better. And anytime a patient tells me about their most private, intimate fears that have to do with their medical care, I mean, it's a blessing to be able to help them and a true honor to that I'm part of their lives.